Okay, it seems we've got a quorum, Rachel, so you can begin whenever you are ready. Thanks everybody for joining today's meeting.
Thanks, Sharon. I appreciate it. Welcome everyone to our October MAC meeting. Happy to have you all here. First, we will start off with, I will take a motion to approve the August 2025 minutes, if anyone would like to make that motion.
Move to approve.
And this is Brian, I can second.
Thank you. And as usual, is anyone opposed to that? We'll vote by silence, unless if anyone's opposed. Dory.
Sorry, Rachel, I didn't hear who made that motion.
It was Dr. Britton.
All right, thank you.
Yeah, of course. Awesome. So secondly, we're going to do some MAC committee updates. Daryl is now serving as the new member at large. Welcome. Well, Daryl, you've been on the MAC for a minute now, but we're excited to have you as the new member at large. And we also have some new members as well. First of all, a welcome to Matt Poss, who is the new consumer representative for Native American communities. Matt, would you like to take a second to introduce yourself? You don't have to, but I like to give everyone the opportunity if they would like.
Sure. Can you hear me okay?
Yes.
Okay. I'm out in the mountains on PTO. Sorry. My name is Matt Post. I'm the executive director of the Urban Indian Center of Salt Lake. And I've been there for about 3 years, but roughly about 20 years in healthcare. So looking forward to participating in this.
Awesome. Thanks for being with us during PTO. I appreciate it. And I know others do as well. And we have another new member as well. Welcome to Sabra Ewing, who is the new consumer rep for Medicaid recipients. Would you like to introduce yourself as well?
Yes, my name is Sabra Ewing. I've been on Medicaid since 2018, and I'm currently on SSI, but I do a lot of disability rights advocacy work, and I wanted to make sure that disabled people are represented on Medicaid, especially since new web portals and things are coming out, and accessibility in Medicare and medical care has been up for discussion.
Thank you. We're excited to have you, and we're excited to have your voice and your input, especially with the changes that you mentioned. And then more changes. I want to give a big thank you to Brian Monson and Michael Hales, who have termed out of the MAC. As many of you know, Michael was also our chair of the MAC for quite a while as well. And Brian's been on also quite a while. Thank you guys both so much. I personally really value a lot of your input, and you've taught me a lot, and I really appreciate it. So thank you both. I'm not sure if Michael's on, but I know Brian is. So if Michael's not on, I'll send him a message.
I'm here. Thank you, Rachel. That's very nice. Thank you.
Yeah.
Yep. Thanks. It's been a privilege to work with each of you in the department, and I'll still be attending, but your replacement for me will be even a bigger improvement for the MAC. So
and I think both of you know that I'm totally open to taking questions from non-members as well, and I hope everyone knows that. We're not too much of gatekeepers here. So just a reminder, I like to remind people, even if you're not a member, we welcome questions and comments from others as well here. That being said, we also have an open appointment for a consumer representative for Medicaid recipients. So if you are a listener or if you know someone that would be interested, please encourage them to reach out to Sharon or Dory or myself to apply for that position. We do need it filled. Any questions on any of our changes or switches around? All right. So our third agenda item, after some polling of the group, we did vote, or we do have to take a vote to change the time for the MAC meeting. The first time that we had didn't work for many people, so we sent out a poll. We have no, we have found that the third Thursday from 2 to 4. Oh, sorry, that's the one that we have now. Sorry. We found that the fourth Thursday from 10 to noon in January, March, June, August, and October was the time that worked for everyone. And then the third Thursday, 4 to 6. And then the fourth Thursday, 10 to 12 for the May meeting. That is our budget presentation. So we usually do that at a different time, but we decided to keep that the same, given that time block works for everyone. I will take discussion, but I'll also take a motion to approve the time change. We know that there were maybe 1 or 2 people this time didn't work for, but this was the time that worked best for the entire, most of the.
That's a joke. Motion to approve the new meeting date and time.
I'll take a second on that.
This is Matt. I'll second that.
Thank you, Matt. And then for this one, I do think that we should vote. So either speak or type your approval or not approval of the time change.
Aye.
Aye.
This is Brian. I probably should abstain just because I won't be there anymore.
Understandable. I don't remember if I vote, but if I do, aye.
This is Davis. I approve that too.
Thank you. I think that motion passes, given the thumbs up and collective verbal ayes. Dory, are we good? Just want to make sure.
Yes, very good. Thank you very much.
Thank you, Dory. With that, we will move on to agenda item number 4, which is the notices committee update. Some of you participate, both MAC members and non-MAC members, and I think some BAC members as well, participate in the notices committee, which is to review some of the notices that Medicaid sends out to members. So I'll pass that off to Tatiana to do a quick update.
Thank you, Rachel. Good afternoon, everyone. My name is Tatiana Mateus. I work in Holy Cross Ministries, and I am certified in medical death legal advocate. So I help people applying for Medicaid, and then I apply for help people to help with financial assistance with different hospitals. So I would like to take a few minutes to update you on the noises and the work that we haven't done in these meetings. So far, the committee has reviewed 199 notices, which is a significant step forward. We are on track to complete the review of all remaining notices by our November meeting. We are continuing to make improvements along the way. Give me one moment. Sorry. Our main focus in making the notices is to be clear, easy to read, and more actionable. To achieve this, we are being concentrating in several key areas, like first, using plain language wherever possible. The goal is to make anyone can read the notices and understand the information without confusion. We are also highlighting the critical sections, like such good information or important information to read immediately, like what is the part that matters the most in the notices. Another focus is improve the visual layout. This include headings, bowling points, and spaces to make notices more organized and user-friendly. For example, for another items that require immediately attention, that we are using bold text and clear wording to indicate urgency, including exactly what action is needed and what is the deadline. For example, to keep your Medicaid open, return the verification by June 30, 2025. So we are being specifically telling to the patient what they need to do and when they need to do it. We make sure to include contact information, business hours, and helpful resources so the reader can turn if they need or have questions to guide them to take help and where to take it. And finally, we ensure all applicants of Medicaid and CHIP policies, the policies that include in the notices, we include some guidance for them. And thank you to the feedback, the notices become much more accessible and actionable. And the improvements help people to take quick action and the responsibilities that they have to process the eligibility. And that's all the update they have for now.
Sorry about that. I couldn't get off mute. Thank you, Tatiana. Does anyone have any questions for Tatiana or comments?
I had a question.
Yeah, go ahead.
I was also wondering, are they making sure that the notices are accessible to screen reader users and optimized for large print?
Can you repeat your question again? Sorry, I don't
Yes,
understand very well.
I was wondering if the notices are, they're making sure they're accessible to screen reader users and that they're optimized for large print.
Well, I know that we are trying to work in my case, that everybody has access to read it in the best way possible to understand, and don't use like wording that are so hard to understand. But about, I think that Gina can answer better that question.
The My Case website has had serious issues with accessibility. That's where those notices are. Okay.
Andrew, you can go ahead.
Rachel, I was just going to volunteer to work with Tatiana and Sabra on that if they would like.
Yes, I would like that. I've been trying to help the My Case website be more accessible for years.
And Gina, I don't know if Gina's on, who
Yeah.
heads up.
Rachel, Gina's not here. She's actually doing a training during this meeting, unfortunately. But I'm not sure if Melissa Presley is on and maybe she could speak to this. And if not, we can bring it back next month and bring back some information on that. But if Melissa's here, maybe she can talk about it.
Yeah, I was actually going to chime in. I know with some of the things on My Case, we've been working with our 88 officer on that. For the paper copies, those do have to go through a request for accommodation for those. So those that are not on My Case and still get the paper notices, that's a special request that goes through. But as far as the accessibility issues on My Case, I'd love to know more specifics about the issues that you're running into.
I would like to make a comment there, because I work with many patients, and it will be useful to have a flyer that can teach the patient to know how to use this application, because it's very hard sometimes for people to get familiar with the technology, especially the people that have Medicaid. They don't have really good education how to deal with electronic devices.
Rachel, I can concur with Sabra and others that it is that my case is challenging to access if you have visual or other accessibility needs. So I do think it is something that the forms accessibility group should consider taking on as one of its projects if it has capacity capacity to do that.
Yeah, and
Maybe if there is a way the customer service through the phone will be able to deactivate this notification through my case will be useful. Sometimes our clients use somebody to help them and they open my case for them, but they don't have any idea. So then they don't receive any more notifications because they don't know how to access to this information. And do you call customer services? And they will say, no, I don't have the possibility to share up these notifications through electronic. And then anyways, the person is still being challenged by these electronic devices getting in their account, right? It's still the same challenge for the client, even when they are contacting the customer service line. And I think that it should be a way that if they provide the permission to deactivate this way to get notification, they can do it. I think that we have to have that option.
So I think there's maybe two different issues. I think if there's accessibility issues with just viewing my case and viewing notices, we can work through those. I think notices itself is more for the work group, but I think if there's accessibility aspects, I'd certainly love to know about those, and I can get in contact with our accessibility officer and things like that we can get resolved.
And I would ask, this sounds like a big enough issue, and I agree that I think this goes a little bit beyond notices committee. Not to say it's like more or less important than notices committee. I think it's like even outside of that in that sense, because it is, accessibility and accessibility related, which is a little bit different than what notices does. So I think I would request, I don't know if anyone else would be interested in a future meeting, either our next MAC meeting or another future one coming up in the near future, kind of some action items from the department on this and what we can do to fix this in a fast way, because to me it seems like a big enough issue that I'd like it added to an agenda, both not even just a discussion, but just from you guys, what can be done in the timeline for that, because I know that my case in some ways does have some limitations, but this doesn't seem like a limitation that's acceptable to me, at least. If that makes sense.
We typically will, if we're finding customers have any accessibility issue, we work with our officer. They can give tips and tricks on how to view it differently, things of that sort. So there's a bunch of different options. So I think we can work that through that are kind of separate than the notice work group. So I'd love to know more about that, and we can make sure that we get those things addressed.
Thanks everybody. Appreciate it.
Thanks for bringing that up, everyone. I think that's actually quite important for all users of the platform. Any other discussion either on that specific issue or anything else for Tatiana related to notices?
I just had one last comment.
Mhm.
The website itself doesn't comply with WCAG guidelines, which is a measure most agencies use to see if they're following the ADA. Just saying that a customer can try to get help over the phone when a website has an obligation to be accessible. And it's not that screen reader users don't know how to use the technology. The web elements are not interactable, and there's been other accessibility issues. The website keeps changing all the time, so I'll have to see what it's like right now.
Thank you. Okay, I would like to see this as like a near future, if not the next MAC meeting, the one after that, some items from the department about how we can make this accessible upfront and not in like a request type manner. I get what you're talking about. So I will make note of that, but I'll bring that up in our next executive committee meeting as well. Anything else on notices? And this is just me saying anyone that is interested in the notices committee to make the notices more clear, plain language, easy to read, easier to comply with. I'm pretty sure, correct me if I'm wrong, the notices committee is kind of open enrollment, if you will. You can join if you would like. So please reach out if you're interested in joining the notices committee, because the more people we have on that, the better the notices we will get, in my opinion, at least. And I think we can move on now to agenda item number 5, which is a BAC Beneficiary Advisory Council update from Dr. Iqbal.
Thank you, Rachel. Good afternoon, everybody. My name is Ronak Iqbal, and I'm the Medical Director for Medicaid. I also chair the Beneficiary Advisory Council. So a couple of updates. We had our most recent meeting. We welcomed 3 new members. We also had a couple of demonstration and presentation. Debbie and Jennifer showed us how to use Find a Provider tool, while Denise did a presentation on EPAS, which is Employment-Related Personal Assistance Services. And then this was followed by Michelle, who gave us a quick update on HRN federal updates. We had a very nice discussion about all of these. These presentations were quite helpful. There was a lot of member engagement, lots of questions and answers. I do want to bring to everybody's attention that our next meeting is going to be on January 8th. It's between 2 and 3 p.m. and it's an open forum for people to join if they would like to. That is all I have to say for the BAC committee meeting.
Any questions or comments for Dr. Iqbal on the BAC? All right, I will turn it again back to you, Dr. Iqbal, for a Rural Health Transformation Fund update. Much has happened since our last meeting.
Thank you so much. So as you all know, that the Rural Health Transformation Program is up and going. We have our application deadline November 5th. So we are 22 days short of that deadline. And the awardees will be determined by December 31st. This is a $50 billion project over 5 budget periods, with expected total awards are 50 states. Each budget period, the recipients will have until the end of the following fiscal year to spend the award funding. I do want to point out that this is a unique funding type. It is a cooperative agreement, not a grant. So a cooperative agreement is an agreement between both the recipient as well as the CMS. And the uniqueness of the corporate agreement is that if the award is given and we don't meet the issues that we stated why we would be spending the money, then the CMS or the federal government has the right to ask back that money. For us, we are very grateful to our project teams and leads. We've been working very close to work towards the 5 strategic goals. Our work leads have been working on Make Rural America Healthy Again, sustainable access, workforce development, innovation care, technology, and innovation. Tomorrow at 9 a.m., all the work leads and their members would give us their top 3 agendas in each category of these buckets. And then our team will start to compile them together to start to make a one solid application for the state. As you know, prior to the work leads actually giving us all the work, we had multiple stakeholder engagements. We also held 2 open forums on October 8th and 9th. And we've taken all the information that we have gotten from the open discussion sessions, the open forums, and we've heard what the public had to say, and our work leads and their members have actually put all the concerns into those recommended buckets. I'm happy to say that we had over 200 proposals that were received, and we have read each and every one of those proposals. We took the proposal and put it into its appropriate bucket so that the work team leads could further review them, organize the need and the accessibility part of it. The things that we are very much focused on is the success of sustainability. And that's where our request to our work team leads has been to look at every proposal, every initiative with the eyes of, is this sustainable? But we want to put forward the best proposal possible. At this point in time, starting tomorrow at 9 o'clock, when we receive all the 5 group lead member projects, then we will start to draft an application. Preemptively, we've started to work on our vision and our strategic goals and our guiding principles. We're also making a small draft that is going to be shared with the legislative office. Then we will make sure that we compile everything and have it ready for our EDO and Tracy to look at. And then we will have 24-hour time period to take any recommendations, final acknowledgements, corrections, and then hopefully by the 4th, we want to have our application ready and to submit at on the 5th of November, which is our deadline. So I am very grateful to everybody who has taken a part, to our team leads, to our working members, and of course to the stakeholders who have taken participation. Going forward, what you can expect is once we've submitted our application, on the 31st of December, we will find out how much money we have received. And then based on that, we plan to have RFPs for those initiatives that went through our grant. And then we'll open up entire process of RFPs and in those particular specific initiative where the funding is available. And then we will take it from there. We are trying also in the meantime to keep our website updated so that you can always go back and refer back to our website. Obviously, all the stakeholders, the community members, and anybody who's taken part in the open sessions, we have their emails. And once the request for RFP comes out, we will be sending out a mass email in addition to putting it up on our website to request stakeholder engagement again. That is all I have to say. I'm open to any questions.
All right, hearing no questions or comments. Thank you, Dr. Iqbal, for both of those updates. I appreciate it. Then we can move to agenda item number 7. I know that Director Strohacker couldn't make it today, so I believe Brian will be doing this part.
Hi, yes, that's true. Brian Roach here. A few updates I would like to give for the group. First of all, Jennifer Strohacker passes on her her apologies for not being able to join, but she is out of state right now. The first item to speak of is HR1 update and next steps. So we're continuing to make progress. everyone here, I believe, knows that Michelle Smith is now acting as the project director over the department's implementation of everything within HR1. So we as well would like to remind you that we launched last month a website dedicated to our efforts. No new updates there as of this moment, but we will continue updating that in the coming months. We have recently met with our ACO partners to discuss potential partnerships on member supports. Community engagement is, of course, a major piece of this. It's not the only piece, but supporting members to understand their responsibilities, as well as reducing member impacts or improper closures or anything like that. We're beginning to develop those member supports, recommendations in conjunction with the ACOs and our own department leadership. Not much I can speak to it right now, but we are working in the background to propose a robust member support framework. We're also working on an MOU with the Utah System of Higher Education. This would allow us to get some higher education data. Education is a participation item under the community engagement requirements. So if an individual is working, I believe it's at least half-time, or potentially a combination of participation, like education with some hours of work, can be marked as education. So as much as we can do to gain access to data to verify that on behalf of the member, we are seeking that out. And so that's our efforts with trying to get some data from Utah System of Higher Education to verify that. Likewise, we're trying to make some system improvements with recognizing medical frailty, as it's termed within the bill, which is a series of classifications that could exempt an individual from being required to participate in community engagement. We believe that we will be able to use some of our own claims data and encounter data and be able to exempt an individual using that data and interface with DWS to achieve that. There's lots to define in the specifics about what conditions. We don't have that definition laid out, but we know the system side of things is going to help our members, help our administrative effort. So we're beginning to map out the system requirements for that. Those are some minor updates. Michelle, as well, I should have mentioned at the beginning, she's out of state. One of the things that she is also taking on is hearing from other states. So she's at a conference with multiple other states right now. We hope to learn from other state best practices and adopt those with our own implementation. So that's all I was going to present on that first bullet point, HR1 update. I'll keep going unless someone wants to raise their hand. I can stop for questions. The next on the agenda is the Emergency Medicaid Enrollment CMS letter. This is, I believe, I'll paste it into the chat window. It was a letter released at the end of September by CMS. Really, the headline, at least for Utah, is there's no impact for us. To go a little bit beyond the headline is that it is encouraging states to use a fee-for-service payment system with regard to emergency Medicaid services. So those individuals who are only eligible for emergency Medicaid services, and we do operate in a fee-for-service payment structure for those members. So we are already adapting to what CMS strongly encouraged all states to do. So no impact to Utah on that CMS letter. Next, moving on, is about the OIG audit report. This, we thought it was somewhat relevant to this advisory committee, even though DHHS was not, we are not a party to the audit in terms of we did not conduct the audit or we were not audited ourselves, but our oversight agency, which is Office of Inspector General, was audited by the Office of Legislative Auditor General, so an arm of the Utah State Legislature. The audit did result in some recommendations to improve the oversight of the Medicaid program. It did give some critique of the OIG's performance, including how they prioritize audits and their governance. Neil Erickson has been responsive to this item as it's come up at the subcommittees that have been conducted at the state legislature. Neil has also taken an interim inspector general role with the office and has welcomed the opportunity to improve the process. I could just briefly, if Neil is on this call, introduce him real quick.
Brian.
Thank you, Neil. But yeah, so Neil, if you want to speak for just a second about yourself, but thank you, Neil.
Certainly. As Brian said, I'm Neil Erickson. I'm the interim inspector general. I was appointed by the governor about 3 weeks ago when Jean Cottrell had left the position. We've also, our deputy, Nate Johansson, has also left the office. So we have a new management here at the Office of Inspector General. We are addressing all the different recommendations within the OLEG audit and hope to see resolution with those. We're trying to work closely with them to make sure those are fulfilled as we go forward as an office. And that's kind of where we are. If anybody has any questions, please feel free to reach out. We are available and happy to answer any questions that you might have. Thanks, Brian.
Yeah, thanks so much, Neil. Moving on, so federal government shutdown impact. There really has not been much impact to our administration of the program. The individuals at CMS who we work with on a daily basis are still at their job working, helping us with state plan authority, waiver authority. So there really is not much impact to our day-to-day administrative work. We still have everybody we need to get in contact with at CMS responsive to us. So that is the short of the federal government shutdown impact for our program. And then upcoming policy changes, I won't mention too much. I think one item I'll quickly mention is that we have been working on operationalizing the Medicaid doula services that was initiated out of the last legislative session. It was Senate Bill 284, actually, and it authorized us to cover doula services in the prenatal and postpartum process and in the birthing process. It also asked us to create a small work group for community feedback from subject matter experts and doulas themselves. We have conducted that. We've got excellent feedback from the group. We're in the process of implementing or developing recommendations based on that feedback. We are shooting for a implementation date close to the beginning of next year, 2026. We haven't fully finalized that, the exact implementation date, but we're working vigorously. It will require some change requests to our PRISM system as well, and coordination with our managed care plans, because they will cover the service for a pregnant member that's covered by the ACOs. So that is the primary policy change I wanted to highlight there. And then lastly, the transition plan for Medicaid director. So if this is news, I am sorry to be the bearer of bad news for those that don't know, but our great director, Jennifer Strohecker, has accepted an opportunity outside of state government. So she is resigning her position as Medicaid director at the end of this month. She has served for almost 4 years now, and it's been an honor to work for her. She was placed into her role during the pandemic, and through her directorship, she has overseen some pretty monumental changes for the Medicaid program, including unwinding our development of our implementation of the PRISM system, as well as some expansion of the program. HRSS was the program that we implemented during her directorship, the Justice Involved waiver, adult dental, extended postpartum coverage, continuous eligibility for children, the state CHIP program, expanded school-based services, and more. I myself have been very thankful for her service and her years of dedication to the program. We are going to be okay. We have Nate Checketts is going to serve in the interim director role while we seek out a replacement for Jen. So obviously Nate Checketts has years of experience to be able to support in an interim role for us. And we are seeking a replacement for that, for the replacement for Jen, and actively recruiting right now. I also do have to say Eric Grant, who many of you know, he is another assistant director for the program and has had multiple roles throughout the year, throughout 21 years of service. He is also moving on to another opportunity. These are unrelated opportunities that just happen to come at similar times. So I do also want to thank Eric for his years of service and dedication to the program through multiple decades of service. Some difficult movements, but we will continue to keep the lights on, keep our good progress going. One other movement, which is relevant, especially for the next item on the agenda, Jennifer Meyer-Smart, it has accepted a career mobility role, so she will be serving as the director of the Office of Eligibility Policy. Very thankful for Jennifer Meyer-Smart for taking that role, helping to replace Michelle as Michelle moved into her new role. So this is positive for us. Most of you know Jennifer Meyer-Smart has been serving as the assistant director for the Office of Managed Healthcare, and will continue to help out until her replacement is there. A lot of us are wearing a couple hats right now, but we're really grateful for Jennifer to get started on eligibility policy as well. So those are the culmination of those items for the director's report, and I can take any questions if there are any.
Thank you, Brian. I've loved working with Jen Stracker and Eric Grant, so they know that, and I've said that many times, but I just felt like I should say it here too. But Brian, I do have a question for you, and I didn't put this on here, and I understand that I have a say in the agenda, so sorry. Put you on the spot a little bit. For a waiver update, I know the government is closed, so you're not really doing any work on getting any waivers approved, but in particular, I'm interested at some point, I know there was some movement on both the traditional healing waiver and the family planning waiver. Has anything new on that front? I had heard multiple conflicting things, particularly about the family planning waiver, that I was going to get approved and then that wasn't. So I don't know if you have anything that you can share with us right now on either of those two, or any movement on any other waivers. Those are just selfishly my two interests right now.
Yeah, no, it is a good question. And actually, we've been able to get some progress even despite the shutdown. This is an example where the people in the CMS group over that area are still there every day working with us. We do expect, I mean, sometimes we joke about the word soon in the Medicaid land, but we do expect approval soon on the family planning waiver specifically. Just as a reminder for the group, this would allow individuals up to 185% of the federal poverty level to get just a slimmed down benefit of family planning only services and related services. Sorry, I'm sure, Rachel, you're well aware of it, but I spoke broadly for the greater group in case they're less familiar with it. The traditional healing waiver, we don't expect that to be in a the soon approval that I mentioned, but we do expect it to be prioritized soon afterward. And we'll be working with CMS to do that. It helps us that 3 other states, to the last I understood, got approval, so CMS can just essentially use that as a template for approval. And that is what we're advocating for, quicker approval after they're done approving our family planning waiver. A couple other administrative things that are not substantive, but we will probably talk about at the next MAC meeting.
Awesome. Thank you, Brian. I appreciate it. And that's exciting because the family planning waiver in particular has been hanging out for quite a while. So I'm glad that it's still in the soon bucket, and I do understand that soon is relative. Any other questions for Brian on anything that he presented, or any other things that he may be able to answer?
I had a question.
Yeah, go ahead.
I'm not sure if this is outside of the scope of the waiver, but I wanted to make sure that the family planning services would be evidence-based, and that also when disability was involved, that they would provide the accurate information. Like if you are either going to have a baby with a disability, or if you're a disabled person trying to factor that into your family planning needs.
Well, thank you for the question, Sabra. I think one thing just to clarify, so it would be not a pregnancy, like a prenatal type service. So I think if I did understand the question correctly, it sounded like a question related to some prenatal services related to a child that may be disabled, and as if I did, please correct me if I didn't understand the question, but it wouldn't be for like a prenatal scope of services.
Oh, okay. So would it be for people who are, would it be for people who are pregnant or people who aren't pregnant?
mostly for people who are not pregnant, who are planning, maybe planning to become pregnant at a certain point in time, may want to consult with their provider about the timing of that. But it's largely about planning for pregnancy or other maybe contraceptive needs or something like that is the primary focus. So
okay, I understand. And so that means the funding is available, but my question would probably be provider dependent.
well, I mean, so separate to this waiver, we do offer just full Medicaid services for traditional pregnant women. And I mean, if there is a question there, maybe we could connect afterwards, but the waiver specifically I was talking about is for a very limited set of services.
Oh, okay. Thank you.
Yeah, I appreciate the question. Thank you.
I just made the question through the chat. Maybe it's more clear to do it there. I was wondering if there is any trainings that we can get a day with policies. No, I know that there is a BAS policies and Medicaid, but at least the general policies for get training.
Yeah, well, thank you for the question, Tatiana. So we can offer a few things that we already do and also consult with you on other options, but we do pretty frequent trainings ad hoc with community partners. And so we would probably want to talk to you about what type of training, like policies you're most interested in. Eligibility policies, for example, or if it's certain medical policies or something like that, we can tailor the training. If it's about some of our home and community-based services, we'd be happy to tailor the training that way. But that would be our primary. So if we could maybe connect right after this and get some specifics about what you would like training on. And then, I mean, generally speaking, we do refer people to our Medicaid information bulletin, which has the bi-monthly or every other month updates to the Medicaid program policies. But I think based on your question, it sounded like more of a general overview, which I think I would lean towards my first comment of offering that we have plenty of people that we would be happy to offer a training.
I will appreciate it. Thank you. I think they wish to talk more about it.
Sounds good. I will connect with you after this meeting.
Okay, thank you.
Other questions for Brian? All right, hearing and seeing none. I think you're off the hook now, Brian. Thank you so much. I appreciate the updates. It's always very helpful. And so we'll move to agenda item number 8, which is an eligibility enrollment update from Jennifer.
Okay, thank you for having me. And I look forward to attending this meeting again. I've attended it in previous years and I've missed being here. So let me go ahead and present. Okay, can you see that okay? Okay. Okay, first we'll look at the enrollment report dashboard, and let me go ahead and share that in the chat so that you can go in there. Okay, so first we'll look here at the person's enrollment for the month of September 25. As you can see here, the count was 348,773. So it largely remained pretty stable, and it has for months now. There hasn't been much of a big change there. There was an overall slight decrease, but again, pretty stable. So And I'll just mention again, as Michelle has in the past, you're able to go in and look by program if you would like to do that. We won't go through each one, but moving over to the data table again, this is something that you can go in and look at by program, see the individual count for each month, so you can see the comparisons. And again, not too many changes there. So, and if you do have any questions about that one, you can stop me or reach out later as well if you look at that later. Okay, the next one, the eligibility data dashboard. Let me put that in the chat as well. Okay, this one, I'll just mention, again, as Michelle said in previous months, I won't go into too much detail, but you can, for those of you who aren't aware, you can toggle through each of these tabs to get information on each of those. But we will look at the review tab. And again, just mention one of our focuses here on ex parte reviews completed for the month of August. It did stay fairly stable, so we're still doing pretty well on that. It did go down slightly to 39.03%, but not too much of a change. And for those of you that are not aware, an ex parte review is a review that is completed without a member participation. So that's a really good indicator of, of what we're all doing. So, okay. And again, if you have any questions, reach out. The next one is the 1115 data dashboard enrollment. I will share that in the chat as well for those of you that have not seen this. Okay, and again, this is just a reminder of this dashboard. It pretty much lines up with the enrollment data that we saw in the previous one. But again, this one is broken down by the 1115 waiver demonstration populations, as you'll see here. So it will largely be reflective of the other one. But again, if you're interested in looking at that by waiver program, you're able to do that. And again, I won't go into much detail on that. Just feel free to look through that and reach out if you have questions. But you can toggle here between enrollment and benefit as well, so that you can see the different ways that that's broken down. So again, if there's any questions, just let me know. I don't know if you have any questions now. Go ahead and raise your hand. If not, feel free to reach out, and I'll just put my email in the chat as well if you want to email me separately. So. All right. If there's not any questions, I'll turn it back to you, Rachel.
Thank you. I appreciate it. Any questions? All right. Hearing and seeing none, I think we can move on to our last agenda item, which is just committee member updates. Does anyone have any updates? Or alternatively, I'll open it up to requests as well. Anything that people want to see on future agendas.
I had an idea for an agenda topic.
Yeah.
I wasn't sure if this committee does Medicaid transportation services, because I think there have been issues with that, particularly for disabled people. For example, they say you're not eligible for those services if you can use paratransit, except paratransit doesn't do open returns for medical appointments, and they don't have service areas everywhere.
I think that falls under our scope. I wouldn't see why it wouldn't. So, yeah, we can ask for some updates on that, and then maybe, take some suggestions from the group, because again, that sounds like someone can correct me if I'm wrong. Did this come up recently? Was there something, did maybe you guys change? Maybe I'm just thinking of like a vendor change or something like that. Am I making that up?
So I can't speak to it, but I will say you're not making it up, Rachel. I think in one of Jen's director's reports, she touched on transportation and our curtain vendor and the changes there. So Brian, I don't know if you want to do that, but she did touch on it recently, but yeah.
Yeah. Thanks for the question. I mean, the item that was discussed, it may have been a month or two ago, was about a Chapter 11 bankruptcy for one of our vendors, which is Motive Care, for non-emergency medical transportation. However, the nuance of the bankruptcy proceedings is that they had no, largely around debt restructuring and had no impact in their day-to-day operations. So we continue to have an unimpacted contract with them. So the concerns brought up, Sabra, and thank you for bringing up the question. I will want to connect with you to learn a little bit more about.
Because I think the way they're determining eligibility is inadequate. And then having to get a doctor that you know who doesn't know about it, like it's already been documented through UTA that you can't functionally use the bus system. But then just because you're eligible for paratransit, they don't offer open returns, and also they don't go everywhere. I had to go on paratransit to a train station and then get on UTA on demand, which was very dangerous because of how it operates and very difficult to get to my doctor in Riverton, for example.
Well, I'm sorry to hear that, but if I don't know, well, I probably do have your email address, but if you wouldn't mind, I'd love to connect with you and try to address that.
Yes, my case manager at Molina could tell you about it too if you wanted to.
Absolutely.
And we'll put that on. We have like a running list of things, so we can add that as a future update and action item as well. And I will keep an ear out if there's anything that we need to do from like a policy standpoint to, you know, possibly. I know some of this stuff is like roadblocks in terms of like policy. If there's anything, you know, there's a lot of people in here that work with legislators. If there's anything that we need to do, you know, to make it easier for you guys to have that process more streamlined so people aren't, you know, jumping through more paperwork hoops and things like that, I'll keep an ear out for that and, you know, get the right people involved there, because it sounds like it might just be something that needs to be I don't want to use the word automated, but streamlined, I think is the word. But I know sometimes you guys can't do that because of one line of legislation or one line of a bill somewhere said something that you guys have to do that. So if it's something that we can, obviously the MAC can't necessarily do that, but there's a lot of people that are either on the MAC or listen in on the MAC that might be able to fix that. Any other updates from anyone, or again, any requests for agenda items? All right, hearing and seeing none, we've gotten to the end of our agenda, so I believe that we can adjourn. Our next meeting is going to be January 22nd from 10 a.m. to noon. So our new time. So just note that in your head. If you have a recurring calendar invite, perhaps change it now before you forget. I will also say, Sharon, we can talk about this in executive committee too, although it might be too late. I would like to request, if it's not too late, that we get a room for that February meeting that is like kind of informal for the MAC at the Capitol, where we go over some of the policy stuff. I know things might be a little bit weird with the transition to a new Medicaid director, but I would like to request that meeting be hybrid. And again, it's informal. For those of you who don't know, our February meeting is mostly just going over bills that affect Medicaid and Medicaid members during the legislative session. I suspect we're going to have quite a few this year. I don't think you guys are going to get off. I don't think we're going to get off easy on this year. So I would like to request, if you have not already, Sharon, if we could get a room at the Capitol, if there's still one available.
Yes, I will look into it. Thank you for letting me know that early.
Yes, I learned my lesson.
Yes. So I will get with leadership and we'll see about a room. So that means you are wanting a February meeting, because the regular schedule would be January and March.
Yes.
And not February. So you want one on February, same date and time that we just voted on, the fourth Thursday from 10 to 12, correct?
Yeah. And yeah, it's like that informal meeting that we have. I know like sometimes it's like not even before it was the time change, it wasn't, and the frequency change, it wasn't always like, it's not an official meeting. And then for those of you, we will do that I hope we'll be able to do that in a hybrid manner. So that way, if people don't want to come to the Capitol, can't blame you there. You don't have to. All right. I think then we're good to, I know I just said we're going to adjourn and then I requested something else. So my bad. You know me. But I think we're all good now. So everyone enjoy the rest of your days. Enjoy your upcoming weekends. Stay dry because it's been raining. So have a good one.